So for Tecfidera, we're really excited to talk about more real-world data. So we have some interesting analyses from the MS Base, which is a registry comprising over 70 countries and over 40,000 patients. And we're comparing Tecfidera to current platform therapies, interferons, glatiramer, Aubagio, and fingolimod. We're looking at time to first relapse, and the results of those analyses show that Tecfidera is better than the platform therapies and similar to fingolimod. In terms of that time to first relapse, so an effect on relapse is there are fewer relapses seen with Tecfidera or Gilenya. I think given the amount of time that we looked at in the database, we're not yet able to look at those longer term outcomes that you're referring to. So time to first relapse really is, having relapses are significant for MS patients. So we're really pleased that we have an effect that's significant and greater than the platform therapies. But we will continue to look at, disability and other endpoints that probably confer a more direct correlation to what happens over the chronic disease. But we think that preventing relapses and preventing that first relapse is an important endpoint. In the United States, Tecfidera was approved in 2013, so it's been a couple of years. I think there's always work to be done. We're never satisfied with where we are as a company and what we can deliver to MS patients and the MS community. So, I think that there was a great adoption by the MS community. We think there's over 200,000 patients that have taken this drug so far, and many of them are receiving the benefit that we expected. So, which is a higher efficacy than platforms and a good safety profile. I think that since it's been launched, we really have been able to better define the safety profile, which is to be expected. And right now, we think we're in a really good place of being able to show in the real world that it benefits patients and the safety profile remains stable. We look at everything when we talk safety profile. So clearly, PML is an important risk that's in our labeling that came out after the drug was approved. Recently we've had some label updates that talk about lymphopenia, and we really believe that lymphopenia is an important marker that you can monitor and mitigate the risk of PML. So since we last talked, it's been stable, and we continue to just have the cases of PML. There have been no new cases of PML. We looked at a couple studies in transitioning, and it seems like Tecfidera does work well after platform therapies, and it can manage after some of the higher efficacy therapies as well. But sometimes you have to look at how long you have a washout period. So we think this is a drug that can be used first line. It can be used after other therapies as well. Well, I think that we need to continue to build on the information that we have for this drug. We continue to try to address some of the common tolerability, the GI side effects that some patients have difficulty with. So we continue to work on how can we improve the experience initially with the drug so that patients can actually stay on the therapy and get the hopeful benefits that we think it derives. And we will continue to understand the effect on lymphocytes, as well as look at long-term parts of disability and effect on cognition and brain atrophy.